Welcome to this weekly national COVID-19 update. My name is Dr Agness Mahomva, Chief Coordinator for the National Response to COVID-19 pandemic here in Zimbabwe. This week, Zimbabwe recorded a fewer number of new COVID-19 cases compared to last week. The total average number of new cases per day has continued to decline since August 2020, as demonstrated on the epi curve figure on the screen. The cumulative number of cases since the start of the epidemic in March 2020 is summarized on the screen, with the highest number of new cases recorded in Harare province, followed by Bulawayo province. Last week, I reported that local transmission was the main source of the spread of the virus since late June 2020. This has remained the same. Very few cases coming from outside the country, that is imported cases, were recorded this week, despite the reopening of our airports on the 1st of October 2020. Transmission of the virus in Zimbabwe is therefore still mostly taking place in our communities. That is at home, at workplaces, at church gatherings, at bank queues, at supermarkets and other gatherings. During our monitoring visits to some of these places, a number of people were observed not adhering to the recommended COVID-19 preventative measures, such as social distancing. They were basically promoting the spread of the virus in their communities. One of the best ways to control the spread of this virus is to strictly adhere to the recommended preventative measures, such as I've said before, social distancing, and we're talking at least 1 or 2 meters apart when in queues, at banks, at supermarkets, at bus stops, and other places. Proper wearing of face masks, ensuring that both the nose and mouth are covered, helps stop transmission of the virus from one person to the other. And of course, washing hands with soap and running water or sanitizing your hands regularly is important. This very simple measure has been proven to be one of the most effective ways of stopping the spread of the COVID-19 virus. As we work very hard together, I might say, and continue to strengthen implementation of the recommended preventative social measures, several people have asked about COVID-19 vaccine and what Zimbabwe is doing about this preventative measure. Here's what you need to know about COVID-19 vaccines and our national response. The development of several vaccines by many global researchers, including China and Russia, is at an advanced stage. The World Health Organization has committed to supporting a fair distribution of approved vaccines once the development and the production of these vaccines is complete. Efforts are in progress to accelerate and enhance the likelihood of finding effective COVID-19 vaccines and to enhance critical and reliable evaluation of these vaccines, to assess their safety and efficiency, and to identify those that are likely to be appropriate for deployment to all countries globally. Zimbabwe is carefully following these vaccine development processes. The country will be guided by the final WHO recommendations on vaccine safety, use, and deployment. In the meantime, we need to continue to adhere to the currently recommended preventative measures. These measures are simple, but very effective. They are working for Zimbabwe. And why do we say that? Why do I say that? In August this year, global researchers from the Partnership for Evidence-Based Response to COVID-19 conducted a survey here in Zimbabwe and reported that Zimbabwe was able to delay the epidemic through implementation of stringent public health and social measures that were enacted early in the COVID-19 pandemic response. In September 2020, local experts conducted some modeling assessments. They basically analyzed COVID-19 country data and other relevant information and reported that the public health and social measures that Zimbabwe has and is implementing have actually contributed to the declining number of new COVID-19 cases. This is very good news. Very good news indeed. It is, however, important to note that the declining new cases, as well as the easing of lockdown restrictions that the country is introducing, should not be taken as an indication that the epidemic is over. It is not over yet. The nation cannot afford to drop its guard against COVID-19 at this very critical point. As long as we are recording new cases, the COVID-19 pandemic is not over yet. We need to buckle up and continue to strengthen implementation and, yes, enforcement of the recommended preventative measures at all levels. This is one of the most important ways of stopping the spread of the virus and of preventing any sudden increases in the number of new cases that we're seeing, as is happening elsewhere. We all have a job to do in this response. Let me therefore take this opportunity to remind you that if you have COVID-19 signs and symptoms and you suspect that you have the disease, you must stay at home. You must isolate at home, away from other people, to avoid spreading the virus. Our national COVID-19 response is on the right track, but we are not there yet. We need to continue to adhere to all recommended preventative measures. Do therefore tune into ZBC, the radio, and other media platforms for this weekly update as we continue to work together in the fight against COVID-19. Thank you.